live from Whitney Media, 1460 WVOX, the Greenburgh Report, with Greenburgh Town Supervisor Paul Feiner. You can join in the conversation at 914-636-0110. Now on 1460 WVOX, here's Greenburgh Town Supervisor Paul Feiner.
Good morning, Westchester. I'm Paul Feiner, and we have a very interesting program today. My principal guest is Kenny Herzog, who's an editor, a strategic communicator, a marketing expert, a reporter, and journalist with 20 years of leadership experience. And he's helped build brands, and recently he's been very helpful to the town of Greenburgh as executive director of VAXUPWESTCHESTER. He's overseen all efforts trying to encourage people to take vaccines, to educate people about the importance of taking vaccines, and he's been helping to save many, many lives. Kenny was also part of our COVID Angels Committee, was a founding member of that committee, and also participated in the Greenburgh Snow Angels efforts for a number of years. So, Kenny, thank you so much for joining us.
Wow, Paul, thank you for, I'm flattered for that introduction. Thank you.
Well, you do a really great job. Could you maybe just start by telling us a little bit more about yourself and why you're so committed to helping other people, around, whether it was Snow Angels, the COVID Angels, and now the VAXUPWESTCHESTER initiative?
Sure. I mean, in a way, it has a lot to do with something like the editorial that we heard just before the start of this show, which was skeptical of mandates and skeptical of vaccines being the way out. And hearing that makes me think, well, if you don't want mandates, then help us get the vaccine out there. If you don't think the vaccine's the answer and you think that's just government intrusion, then you're not actually paying attention to what the facts are. So for me, I'm a fact-based person. And being a journalist for 20 years, I have pursued the truth at all costs. I've always tried to parse credible information from less than credible information. I know credible information when I see it and how to source it, and I know it when I don't. And I know where it's coming from and what the motivations are from bad actors. And it's very important to me that, only the most rigorously researched and reported information is made available to the public, or at least the majority of what's made available to the public, because you can't simply crowd out all misinformation nowadays. But I also care about my community. I care about public health. I care about my neighbors in every community, and your initiatives over the years, whether it's Snow Angels or COVID Angels, etc., we're all sort of perfectly suited to my desire to want to just fit in somewhere with what I thought my abilities and my passions were, and put it to good use. So I actually appreciate you having led the way there. Excuse me.
Well, thank you. Could you tell us a little bit about what VAXUPWESTCHESTER is about?
Okay, so VAXUPWESTCHESTER, which effectively evolved out of the Greenburgh COVID Angels, where the idea was, as you know, Paul, let's help thousands, which we did, thousands of elderly or perhaps homebound or mobile residents around the town of Greenburgh, and then ultimately beyond throughout Lower Westchester. Let's help them navigate this Byzantine process of scheduling their vaccine appointments and getting in for their vaccines in the early going. Then you actually initiated the conversation among some of the COVID Angels cohort in mid-March, I believe, about the next wave is going to be, dealing with the people that don't want the vaccine. And we thought about enlisting, and we did ultimately enlist some teenagers through the Theo Young Center to help us wrap our heads around this and see how we can engage local communities and getting some outreach out there. And then it also kind of evolved where we started just really doing a full-scale marketing outreach campaign where we were creating strategic alliances with agencies and health centers and nonprofits and advocacy groups, and we were getting into communities on the ground that were the most lagging behind the most in vaccination rates for myriad reasons, and trying to understand those reasons and getting feedback from the community and creating messaging around it on social media, through traditional media, through our website, keeping people up to date with the latest, most credible information on the vaccine, and then going and popping up in all these towns, at churches, at mosques, at local businesses, you name it.
We have to take a 5-minute break now, and then we'll be back with Kenny Herzog, and he's going to talk about VAXUPWESTCHESTER, an organization that is helping to encourage people to take the vaccines. Their website is VAXUPWestchester.org. We'll be back in 5 minutes with Kenny Herzog. I'm Paul Feiner.
Now back to the Greenburgh Report on 1460 WVOX. Once again, here's Greenburgh Town Supervisor Paul Feiner.
Good morning, Westchester. I'm Paul Feiner. I'm the Greenburgh Town Supervisor, and my guest today is the Executive Director of VAXUPWESTCHESTER. It's an initiative that the town of Greenburgh helped launch, and it's encouraging COVID-19 vaccinations for anyone eligible. Kenny, I wanted to ask you a question. Are you finding it, when we did the COVID Angels, everybody wanted the vaccine, so it was really easy to get, 4,000 people, vaccinated, assuming there were vaccines available. Now we have vaccines available, but not everybody wants it. Could you tell us why it's so hard to get people to take the vaccine?
Well, I think we've all heard a lot about this, but the truth is people are afraid. I don't care if you're, what your demographic is. I don't care where you are geographically. People have fear. This whole experience has been traumatizing. People don't know what to think. They have so much misinformation and misinformation, saturating their inboxes and their social media feeds and their conversations with their families and peers. So we go out and we find where these populations are, where there's been lagging rates in vaccination. We engage them. We hear their thoughts, their fears. We're empathetic. We're non-judgmental. We acknowledge the validity of what they're thinking, when we think it's valid, when we think that their fears and concerns are based in something that has been passed along to them in bad faith. We try and share that perspective as well, and we have facts, obviously to back stuff up, and we try and debunk some popular myths, but mostly we make it, we show that we're there, we want to listen, we want to talk, we want to be compassionate, we want to educate, and then through the work with our many, many wonderful selfless vaccination partners across the county, we offer the ability to vaccinate people right where they are. We vaccinated people in a car wash parking lot. We vaccinated people in a Jamaican restaurant. We vaccinated people at food pantries. We vaccinated people at park fronts, at mosques and everything else. You name it. So the difficulty is making it apolitical if you're doing this work and choosing to do this work because it's hard work, and being willing to get out into communities that that are outside of your bubble because they ultimately are your neighbors. I just have to say, too, that without the collaboration of not only our wonderful vaccination partners, but Krista Madsen, of course, works for the town of Greenburgh, basically been co-lead, co-chair on this initiative, as well as, number of volunteers that have been willing to do the hard work to help make this possible. We've gotten shots in between 500 and 600 arms across the county, and those are people who were either wary or just had given up and thought it wasn't an accessible, convenient option for them to get the vaccine.
So just by being there at locations that are convenient, it makes it easier for people to take vaccines. And are people really hysterical about the risks of a vaccine? With all the news coverage, wouldn't you think that it would be easy to get everybody to recognize that, they're safer with the vaccine than without it?
Well, it depends on what news coverage they're watching or if they're even watching news coverage. There are people who are only hearing what they hear on the streets, only hearing what they hear from, in their places of worship, which may or may not be encouraging to get the vaccine, only hearing in their neighborhood barbershop or on their social media feed or whatever it is. And so that's why it's important that all those people who own those businesses and preach in those places of worship and are people who are considered local iconoclasts and influencers are sharing good information, credible information in good faith, and if they don't know what that information is, to take a step back and let good information sort of fill the void or direct people in good faith to where they can get, honest, accurate information. So people are coming in with, I think, again, fear underpins everything, and then you layer on top of that saying, information or inputs that conform to this fear that you have that's guiding you to or from making this choice to get the vaccine.
That is, it's such a rewarding initiative that you're involved in. You recently received some national attention on a major TV show. Could you tell us about that and your experience, your success story?
Yeah, well, I guess the first piece is an MSNBC producer was made aware of what we were doing and was in touch with me, and I sort of gave her a few success stories, and then kind of she said, okay, well, I'm a book producer for The Beat with Ari Melber, and maybe the thing to do here is frame a story around people who've overcome their hesitancy instead of constantly inundating people with all the things that we already know about why they don't want to get it, right? So I happen to work with a wonderful woman, and I say work with because I really view this, my engagement with everyone who's initially reluctant, as kind of a process that we go through together. Her name was Sharon, and she was at a Juneteenth event in Irvington with her son, who was 18 and was ready to go to school in the fall, but he wouldn't be able to without his vax. She's originally from Jamaica. They live in the Bronx, actually, by Yankee Stadium. She was all the way up there vending some hair care accessories at the event, and we talked for over an hour. She checked every list. She had religious concerns. She had scientific concerns. She had been hearing a lot of misinformation. She hadn't had time to really seek out the good information, and had just, every conceivable, distrust of government, you name it. But we talked. I gave her my information. I followed up with her. I answered her texts. I answered her calls. I got her onto a live town hall chat online with several of our wonderful, selfless medical professionals and experts that are part of our volunteer cohort to answer her and her neighbors' questions. And then lo and behold, even though she lives across the street from the Yankee Stadium vaccination site, she and her son came out to one of our events at the Tarrytown Sleepy Hollow Farmers Market, an event where we got 17 shots in arms that day in mid-June, and her and her son both got their shot, and now she was the person that was on MSNBC sharing that perspective and that journey about how important it is for our children to get vaccinated.
Right. We have to take another break, and we'll be back with Kenny Herzog, who is Executive Director of VAXUP Westchester, and their website is VAXUPWESTCHESTER.org. I'm Paul Feiner.
WVOX. Now back to the Greenburgh Report on 1460 WVOX. Once again, here's Greenburgh Town Supervisor Paul Feiner.
Paul Feiner, I'm the Greenburgh Town Supervisor. My guest is Kenny Herzog, who is Executive Director of VAXUP Westchester, and their website is VAXUPWESTCHESTER.org. I'm wondering, Kenny, how people sign up to get a vaccine. Do they go through you or and your organization, or is your main role encouraging people to get the vaccine?
Good point. Good question, I guess. So our main sort of self-imposed mandate is to educate. However, because in a large part of the relationships that were built during the Greenburgh COVID Angels, most of which were built by the leaders of the COVID Angels at that time, and thank you to them, we can facilitate vaccinations. And because those vaccination partners are so magnanimous, they've been willing to be nimble and flexible and mobile, and everyone across the board has been doing everything, just for not for any money or for any other reason, and this is the right thing to do. But we do not typically do advanced signups at this point when we have, say, an actual pop-up. We frame these as, educational slash vaccination events. We have one in New Rochelle today at 50 Sickles Avenue. Anyone can come. But we also do virtual informational sessions, like an Instagram Live Q&A we have with Dr. Anisha Mather, who's an infectious disease specialist, Sunday at 7 p.m. Just find us, our VAXUP Westchester account on Instagram for more on that. People can walk in and walk up to our events. They can find information on where we're popping up on the calendar of events page on VAXUPWestchester.org, or by checking out our Instagram, which I believe is just at VAXUP Westchester, if I'm remembering, or just, search VAXUP Westchester on Instagram. Or you can email VAXUPWestchester at gmail.com. And a lot of times we just wind up grabbing people literally off the street. When we go to places, we don't just sort of, we're not just kind of stoic. We go out and we fan out into the surrounding area, and we let people know, hey, we're right there at that building. It's right in your neighborhood. You know that building. You have friends in that building. You have family in that building. We got Pfizer right there. Have you had your vaccine? No. Why not? And we do the thing. And I've pulled people out of their shifts at fast food restaurants. We've pulled people out of auto body shops when their shift is over. We've pulled people off of their butts when they've been having lunch at the park with their family to get the vaccine here and now, because there's no time to wait and no time to waste.
That is great. How many volunteers are working with your committee?
Well, I'll be honest. First of all, we've been doing VAXUP Westchester for about 5 months now, so it's been, there's been rotations. Students have helped, but then students have to return to their student stuff. We've had people who've been in between jobs, but then they go back to their jobs. It's going, on and on and on. But at any time, we really are just motoring on, I'd say, around 10 sort of active volunteers, including myself and including the work Krista does at any one time. And, we certainly can use more volunteer help. And frankly, I have to say, while we did have wonderful nominal grants from UJA and Westchester Community Foundation at the beginning that was allocated exclusively to the teens through the Theo Young Center for their help, everything else, everything I've described operationally and otherwise has been 100% volunteer. I have not, taken a cent. No one's taken a cent. But to do this work ongoing the way we're doing, which it clearly is going to need to be ongoing, we do need support, whether that's in the terms of volunteers from the community or in terms of, frankly, funding from generous benefactors, because this is crucial work, and we have the ability to really do it at a more momentous scale.
Well, that leads me. I remember when Krista Madsen, my assistant, was applying for grants earlier this year. We did get 2 grants, and Krista, you're on the line, right?
I'm here, yes.
Could you tell us about the efforts to get funding? And it seems to me that the funders should be really thrilled because, I don't, they gave nominal grants, as Kenny, said, but I think they've gotten way more than their money's worth because of, I don't think they anticipated an effort so well organized and so persistent.
Yeah, they get a lot for their money with Kenny. I have to praise Kenny for how much he does in this cause and how passionate he is and unflappable, unstoppable. So this money did go really far, but it was, as he said, targeted to these teenagers initially who worked through our community center. We got to hire kids from lower income families in the surrounding neighborhood, in the Fairview neighborhood of Greenburgh, and put these kids onto actually trying to do a community survey to kind of take everybody's temperature. Are you vaxxed? Why or why not? and try to explore these ideas of hesitancy early on when we really didn't quite know what we were dealing with. And our neighborhoods were much behind some others surrounding us. They're more up to speed now. They're still a little behind. There's always still more work to do. But the VAXUPWESTCHESTER umbrella has kind of expanded to whatever area code is in greatest need, and Kenny follows the data. But in terms of getting this money, we were so grateful because it was in writing grants, you usually have to wait so long for a turnaround, but there was such nimbleness and quickness about this that we were delivered money quickly early on when we needed it, and they were really willing to fund anything involving, hesitancy and access at that point. But that money is kind of running dry, and so we're looking into other sources to try to figure out how to make this more sustainable, because unfortunately we're in this much longer than anybody imagined.
Right. Kenny, what would you anticipate now with the Delta and the variants? Do you feel that we're going to be back to where we were, especially with the boosters, and do we think that it's going to be hard to get the boosters once they're available?
I think on some level that can be answered by how effectively people out there receive Krista's message just now, because, to be honest, we were getting messaging out about Delta and cautioning people about Delta in our promotional materials, in our flyers, on our website, on our social media 2.5 months ago. But that message has to be amplified. And that also speaks to, any politicians or elected officials or influencers, from the area that are listening to this. We need your megaphone. We need you to use your platforms to amplify what we're doing just in that word of mouth sense. So if more attention is paid to the work that grassroots organizations like ours, and not only ours, are doing to complement what public health officials are doing to get the word out there about this, and what healthcare workers are doing to get the word out there about this, we will stand a better chance of warding off the next sort of siege of something like the Lambda variant, which is something we should probably all be thinking about and not putting our heads in the sand about, because we can't. This is the one thing as a culture collectively that we just can't look away from, because it's not going away. And I would like to say, and I'll just say succinctly, Paul, to really answer your question, in speaking to my mother yesterday, who was very sad because for a third consecutive year she can't plan any kind of winter getaway with my father, and neither of them are getting any younger. I said to her, look, I've been a pragmatist and a pessimist from the beginning. I told you in March 2020 that we're not going to be back to normal until 2022. I just knew it. But that being said, I am willing to say, if we continue to see these vaccination numbers rise, if mandates go into effect and are enforced and continue to encourage higher vaccination rates, if the full FDA authorization comes through, I got the hook.
Great. So we'll be right back in a couple minutes with Kenny Herzog, Krista Madsen, and we're talking about VAXUPWESTCHESTER and why it's important to take the vaccine and what they're doing to encourage people. I'm Paul Feiner, Greenburgh Town Supervisor.
Now, back to the Greenburgh Report on 1460 WVOX. Once again, here's Greenburgh Town Supervisor Paul Feiner.
Good morning. I'm Paul Feiner. I'm the Greenburgh Town Supervisor. My guest is Kenny Herzog, who's Executive Director of VAXUPWESTCHESTER, and Krista Madsen, who's my assistant, who's been helping VAXUPWESTCHESTER with their launch. Kenny, you have a resources page and it's not only in English but also in Spanish. So, are you doing is VAXUPWESTCHESTER targeting the Hispanic population?
Yes, we are, and it's funny, I'm glad you mentioned that, because I'm just noticing something that I need to fix on it. So, yes, we have been, everything we've done has been at least bilingual. We also have made inroads, with the Muslim community. Thank you, large part to our volunteer Farah Hussein. But we have been bilingual from the start. We have primarily served communities of color, and that's, and we have done our work in the areas of greatest need, and to that are also the areas that were hardest hit by the virus in the first place. Zip codes that have been behind in vaccination acceptance in Mount Vernon, in Yonkers, in New Rochelle, in Elmsford, in Ossining, in Sleepy Hollow, in Peekskill, and certainly, there's a lot of working class Latino families who are worried about job security, worried about security, period, in the most important sense, and it's been a matter of creating a sense of, it's been a matter of trust building, and serving as an intermediary between them and the sort of larger specter of government that maybe is harder to take at face value sometimes. But I think there's actually been made tremendous inroads within the Latino community at large in the country in terms of seeing those vaccination rates rise. And here in Westchester, it bears out, but it's important to make sure that we're doing everything we can. We always have someone who speaks Spanish at our volunteer events or at our virtual informational sessions. We always have our flyers double-sided in English and Spanish. We always have as much information on our website as we can in English and Spanish. We try and find the Spanish translations of actual information from the websites themselves, in addition to the caption text that leaves you there being in English and Spanish. It's that's not only addressing this in the English language in 2021 in New York State is what are you even doing?
Right. Krista, you mentioned to me a couple of weeks ago that, unlike, say, the COVID Angels initiative where, we could do a pop-up event and have 600 people participate, success is like getting maybe 10, 15, 20 people take the vaccine. Is that still accurate?
Yeah, and we have to be happy with lower returns now. That's just how it is. There isn't this huge bang for the buck anymore. We hosted a clinic at the Theodore Young Community Center where we had no trouble booking 750 seniors in a day once. That's ancient history. Now it's this delicate work that Kenny describes of, really feeding people with a lot of information and coaxing them a little bit. And we're happy if, some people stumble upon us and then they can go home somewhat converted and bring this news to their community that they're fine. They had a good experience. These vaccinators are friendly, good people, not trying to harm us. We're all in this for the greater good, and every individual shot is somebody connected to a family and a community. Maybe they have kids in their home. So this is all still really worthwhile, even though we don't see these huge numbers anymore. It's beginning to add up, and the work is becoming increasingly more important the more we do of it.
Yeah, I point to a wonderful event we did at in collaboration with the Municipal Housing Authority for the City of Yonkers a few weeks ago at the Palisade Tower in Yonkers, a residential housing complex. And look, we got 25 shots in arms that day. That was one of the most under-vaccinated zip codes in the county. People were really, really unsure and reluctant, but wanted to ultimately do what was best for their kids and their community. And it did take coaxing. It did take answering questions, because people have valid questions. This thing, if people stay in their Facebook bubbles and just feel like everyone sort of agrees that it's just this kind of virtuous cycle of rage, that's not affecting anything. Step away from the computer, reach out to groups like ours, see how you can help, because there are people who need help and deserve the help and want the help. And it's more constructive than just reducing everyone who hasn't gotten their vaccine down to this one sort of monolithic ideological cluster, and it just makes other people want to dig in even further into their intransigence.
That is that is great. You said you have some. How many pop-ups have you done so far?
Oh my gosh! I mean, Krista could maybe
Some
fact check me on this. I think we've probably done over 30. Now, we didn't initiate all of them from the ground up because sometimes, for instance, the Peekskill NAACP and Peekskill Youth Bureau were having National Night Out in Peekskill at Pugsley Park, and we wound up, being invited into that, and that was wonderful thanks to our Peekskill volunteer, Eve Hartman. But I would say of ones that we've initiated from nothing, I mean, it's got to be close to 20, Krista, I would say.
Yeah, I think so. Maybe more.
Maybe more, and we've made them happen literally overnight at times.
That is great. We just I spoke earlier to this lesson at the Greenburgh Health Center, and we're going to be doing a vaccine initiative at our farmers market on September, I guess,
30th.
The last day of September and the first Thursday in October. She agreed to do that. So I'm really, pleased, with that. In the remaining time, do you have any other success stories or inspiring stories that you might want to tell our listeners?
Well, I think, for one, I think it's inspiring what, people with good intentions can do. I think this is proof positive of that, and so the more the merrier. If you're out there and think you have good intentions and something to offer to something like this, in terms of more kind of stories that are kind of MSNBC worthy, we've definitely had. We had an instance in Yonkers where a gentleman who'd been in prison for most of his adult life was encouraged by us to come and get the vaccine at a site we were doing down the block from where he was because he didn't want to get out of jail just to wind up in a hospital. That kind of thing feels incredible. We've had instances where, we've encouraged people to get their young teenagers vaccinated before school starts, which is exactly what we have our eye on going forward, is we need to get as many children as are eligible vaccinated. Life needs to get back to normal for these children, and when children that are younger than 12 are eligible, please, if you're not immediately willing to get them vaccinated, consider coming to us and letting us give you access to our medical experts who can talk you through the process of whether you should get it or not. Don't just be firm on the fact that it's not something you're willing to do until you see where we are 2 years from now, because we already know where we are virtually 2 years out from the pandemic starting, and it's not good.
Right. In fact, Chris and I met with a student last week, and we're going to be trying to encourage students in Greenburgh to get the vaccines, maybe have a social event with a pop-up vaccine at the social event as a way of encouraging young kids to also take the vaccine. Are you finding that there's a lot of younger people who are also hesitant to take the vaccine?
You're asking me or Krista? Me?
Yeah, that would be great.
Unless, Krista, you had... I'm sorry, I know we're short on time.
Yeah, you have more.
Yes. Yeah, I mean, absolutely. Kids are a challenge because they don't have the same nuanced reasons that adults do. There's not the same variance. There's a universal thread among all teens of, why is this important? Why is this urgent for me? I've already made enough sacrifice. I don't know. I don't care. I got other things in my mind. So it is to instill a community incentive in teens is tough.
Both of you, Madsen, for your efforts helping save lives.
Thank you.
Thank you.
Greenburgh Town Supervisor.